Hi, welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about the Robert Wood Johnson Foundation's Health Policy Fellowship, and I'm joined by Dr. Ellen Kurtzman. So welcome.
Thanks. Thanks for having me.
So before we get started, maybe you can tell everyone kind of a little bit about yourself and kind of what your passion is.
Sure, I'd be happy to. So, Melissa, as you know, I'm a nurse. I'm an associate professor at the George Washington School of Nursing. We're colleagues there, which is wonderful. And I grew up in New England. I grew up in the Boston area, went to a big public high school. And when I was in high school, they offered a program that allowed young men and women in high school to shadow different professions. And so one of the professions they were shadowing because of the nursing shortage was nursing. And so I spent a semester in high school shadowing nurses at what was the local community hospital. I was a strong science and math student, so sort of was inclined to the sciences. And that semester really sealed the deal. I, saw men and women in the workforce doing work that was important, using science and their knowledge to apply to patient care and patient education. It all seemed to be a perfect fit. So out of high school, I went into a 4-year bachelor's program at the University of Pennsylvania and got a BSN and was licensed as a nurse. I worked really for a very short period of time. My interest was actually in aging, which is what your interest is. Some of my mentors at Penn were folks with strong geriatrics and gerontology backgrounds. So I did work for a short period of time on a med-surg unit at one of the best hospitals in the Boston area, the Beth Israel Hospital. In fact, I selected BI because it was one of a few magnet hospitals at the time. Now, the magnet hospital program is enormous, and there are hundreds of hospitals across the nation that are magnet. But at the time I graduated nursing school, there were a couple dozen. And so I was returning to Boston from Philadelphia and figured I might as well work at a hospital where it's sort of the prototypical place to be a professional nurse. And so I went there for about a year and really learned pretty quickly that bedside nursing was not going to be what was a best fit for me. In fact, a story maybe for some nursing students who might be watching, I had a very early needle stick from giving a injection to a patient. And as I was recapping, I stuck myself with a needle and I got a horrible case of hepatitis. And so while I was recovering from that, and that was really only after a year at the bedside. As I was recovering from that, I really had to think, kind of, what can I do with a nursing degree that isn't bedside nursing? Not because I didn't want to go back, but because I just wasn't healthy enough to be at the bedside. I didn't have the stamina and the strength. I was still pretty exhausted. And so I looked to do things that I could more on a part-time basis, and but with a nursing degree. And it was an interesting time in my life. I took some courses in accounting and some business, and sort of transitioned that nursing degree into something that could be used in other ways. And so when I returned full-time to work after that experience, I looked to do health education work. And so I went to work for the American Red Cross, which I think, as most people know, is a national philanthropic organization. They're best known for helping the nation and actually the world with the blood supply, but they also have a very strong sort of platform in portfolio in the education world. And so I went to work for the Red Cross doing health education work in the HIV space, loving it, worked mostly in the public school system, teaching students and their faculties about HIV and AIDS, how to prevent the spread of the infection. And as these things go, one thing led to another, and I got promoted within the Red Cross system. And the Red Cross's headquarters are in Washington, D.C. And so I moved to D.C. As part of the Red Cross workforce, and did that for quite some time. As I lived in Washington, I became more and more interested in health policy, and specifically how policy influences the health of our nation and the healthcare workforce. And so it wasn't long after my move to Washington that my career sort of took a decidedly more direct sort of tact into health policy. And sort of been in that space ever since. I've been at GW for about 10 years. And before that, did work in the health policy space for a variety of nonprofits in Washington, D.C. And being at GW has been a great experience. Both my teaching has been influenced by the health policy work I've done, and my research has been very influenced by the health policy work that I've done.
So let's talk about the research part before we move into
Sure.
fellowship. So when did you get your PhD, and what is your program of research around?
So I got my PhD actually after coming to GW. One of the benefits of working in academia is the educational mission of the university allows professors and faculty and staff to go back to school. And so I did that when I returned to GW. And so I have a PhD I have a master's in public health and a PhD in public policy. So my only real nursing degree is my bachelor's. So I've sort of moved, along with my work, my educational, sort of trajectory has been closer and closer to policy as well. I came to GW to do research. I actually came to GW as research faculty, meaning that 100% of my time was spent doing research. It was all under sponsored projects. I wasn't doing any teaching. And I did that for quite some time until I really decided I wanted to apply what I knew and the policy work I had done to the teaching mission of the university. And so I transitioned to being on tenure track and doing some teaching along the way. My program of research has really always been on how the policy environment influences the care and delivery of healthcare in this country, including how nurses provide healthcare. And I'm also really interested in how policy can be used as a lever to improve healthcare and make it higher value. So sort of that quality cost equation.
Okay. And I always love hearing people's stories about their journey. I think a lot of times either people interested in nursing or in nursing school, they kind of have the public has a certain perception of what nurses do. So to see how you went from being a bedside nurse to getting the degree in public health to then having the public policy. So all that is perfect. And it just goes to show that your natural interest and inclination kind of drive, the experience that you have. So,
well, what I also, people have asked how did you sort of plan this? And none of this was planned. In fact, I wish I had some of the drive and vision that some of my students have, because they know exactly where they're going and where we're headed. I really took opportunities as they came, sort of were, placed in front of me. I think what's been really interesting is that there are enormously interesting things to do. And, maybe one of the qualities I brought to my story is that I wasn't closed off. I was sort of open to these opportunities.
Right.
And when there was an opportunity to move to Washington, D.C. with the Red Cross, I was like, sure, I'll do that. When there was an opportunity to, get a degree in public health as I was working full time, I thought, well, I can do that. And so sort of each step along the way, there have been doors that have opened, and I just sort of walked through them, and that led to other doors being opened. None of it was planned. I think I could have been much more efficient in my journey if I had thought from the very beginning, someday I want to be a professor of nursing. I'm just going to sort of head in that direction. But it was definitely not. It was much more circuitous for me.
Right.
And in truth, I don't think the journey's over. I mean, I think if another door opened and it was a perfect opportunity for me, I would take that opportunity. And I think the lesson in that for me, and maybe for other people, is that there are really interesting things to do. You have to be open to it, and it's not always what you expect or what you planned.
Right. And that's kind of how my path has gone too. So it's called serendipity, but I feel like when you're ready for something and life opens the door, you just need to be ready to step through that door.
Right.
So now let's transition to the fellowship. So the Robert Wood Johnson Foundation Health Policy Fellows are like the cohort. I was, I think, in the cohort before you with the Health and Aging Policy Fellows, and that group kind of all comes together through APSA, or the American Political Science Association. So let's talk about your journey.
Sure.
So
So I had always had my eye on the RWJ Health Policy Fellowship. And for those who may be listening who aren't familiar, first, Robert Wood Johnson Foundation is the nation's largest healthcare philanthropy. It's a private foundation that provides all sorts of funding and grants for important healthcare initiatives. And the Health Policy Fellowship is RWJ's oldest, most longstanding program. It's over 50 years old, and for the past 50 years, every year, they have selected 6 what they call mid-career professionals, which I think just means middle-aged, but mid-career professionals.
I don't know. I had this conversation with Ashley on the other podcast, and I was like, so young to be mid-career. How did that
That's right. Yes. So they pick 6 mid-career professionals. They don't have to be healthcare professionals. They can be social scientists in the health field. And they bring them to Washington, D.C. to do this year-long health policy fellowship. So nearly 300 health policy fellows all across the nation have availed themselves of this program. So it's a huge investment made by the foundation. The fellowship is really organized into 2 parts, if you want to think about it that way. The first part is what's called the orientation, where this class of 6 health professionals and social scientists sort of go through a deeper dive into federal policymaking. That part of the fellowship is sort of classroom style, and you can think about it as a real deep, intensive, sort of semester-long learning in health policy. You travel all over the city of DC and really the DC area, meeting some of the nation's foremost health policy professionals. They brief you on various health policy issues and how Congress and the various agencies work. And at the end of that orientation, each of the 6 health policy fellows chooses a placement that places them either in Congress, the Senate, or the House, or in some cases, people go into the administration, into the executive branch. And you spend the remainder of the year, so between 6 and 9 months, in that placement, working alongside congressional staff or executive branch staff, doing the work of policymaking. I had a little bit of a different trajectory in that I extended my fellowship. So I spent 9 months working for the Speaker of the House, Nancy Pelosi, who's a Democrat from California. And then I extended my fellowship. I wanted a different experience, and I also wanted experience in the executive branch. So I extended things and spent another 4 months working in the administration in the Office of the Surgeon General. So for Vice Admiral Jerome Adams. So my fellowship lasted a little bit longer than most. It was closer to about 16 months.
Okay. So let's talk about your time in Pelosi's office. So what were some of the things that you worked on, maybe some of the people that you met, maybe just some highlights of that experience? I know for Davis and I, you arranged for us to have pictures on
the balcony.
Yeah, and yes. He got his little suit on. He was so proud. And so that was a great moment for both of us. And he's since kind of realized what an amazing opportunity that was. So thank you for that. But
oh, sure. So working in a speaker's office was humbling and rewarding and uncomfortable and challenging. It really tapped sort of so many different parts professionally of where I sort of had, the skills I had arrived with. First, I think what's a little bit different is the speaker's office is relatively large. I mean, as you know, most congressional offices are relatively small. It's a core staff of really hardworking men and women. Because she is a leader in the House of Representatives, because she's speaker, and because she's been in Congress for so long, her staff is actually on the larger side. So she has a full-time health policy advisor. And so my job was really to work alongside him. His name is Dr. Wendell Primus, very well known on the Hill. He's been on Capitol Hill for many, many years. And so working alongside him to support the office in any possible way in terms of their health agenda. So what does that mean? I spent a lot of my time working with constituents and meeting with constituents. As you know, people from all over the country come to Washington, D.C. to meet with their representatives and talk to them about what's on their mind, what's important to the American public. And in the health space, literally, probably in the course of my 9 months there, hundreds of people came to visit the Speaker's office to talk about issues of importance to them. Many of them, most of them from California, because that's where her district is. But because she's the Speaker of the House, she'll take visits from constituents from other areas of the country as well. So I met with a lot of California groups and Californians about healthcare issues in California, but also national organizations that have offices here in Washington that have a stake, obviously, in what happens in California, but have a stake in what happens across the nation. So a wide variety of issues and stakeholder groups, physician organizations, health insurance companies, technology and device manufacturers, nursing groups, as well as a lot of the organizations that represent specific diseases, Alzheimer's Association, for example. Those folks come to town. So they always want to meet with staff. And I would say, maybe 50 to 60% of my time was spent in those kinds of encounters, trying to understand what bills they wanted to see passed, what bills they might be opposed to, what different programs needed funding or needed ongoing support. And I would then, as a result of those meetings, brief Dr. Primus if he wasn't already involved in the meeting. And that information sort of got rolled up to the Speaker so that she would know what the sort of the pulse of the nation was with respect to particular bills or issues. So I spent about 50 or 60% of my time doing that. I would say the rest of my time was spent in two different activities. First, I would represent the office at meetings, both within the Capitol and within Congress, as well as outside. So there are meetings, as you know, happening all the time on different issues. And I would go to briefings, I would go to hearings, and be sure I was up to date on sort of all the happenings with respect to what the issues were. And then the third sort of, if you think about a pie, the third piece of the pie in terms of what I did is I wrote a lot of written documents, what we call policy memos, that would go to the Speaker about a particular bill or about a particular issue that she needed to be briefed on. And I might write 3 or 4 of those memos a week for the entire few months I was in the office. And so those would sort of be her encyclopedia for the week of what she needed to know, what was happening, what was coming her way, and sort of in the rearview mirror looking behind it as well. The issues were as diverse as prescription drugs. That's a big issue right now on the Hill, lowering the cost of prescription drugs, protecting Medicare and Medicaid, definitely working on the ACA to restore some of those provisions that have been chipped away at. So as diverse as really the healthcare issues. This was obviously all pre-pandemic. I think the pandemic has taken a large space in what's happening on the Hill. And prior to that, the focus really was on restoring the ACA, prescription drugs, lowering the cost of healthcare for Americans, and protecting the quality and value. So a variety of bills in all of those spaces.
Yeah, I think when I did my fellowship, it was just really amazed at the amount of information and the number of things that you have to pay attention to if you're, the boss, or if you're in the House or in the Senate. And I just remember thinking, like, this is so much information in a day that, having somebody that that you trust and that can kind of condense things into sound bites so that you have, kind of more of a top layer, level of information.
Yeah, I mean, I have, first of all, I have great respect for people who work on the Hill and in government. I mean, I think one of the biggest lessons for me in the experience is how grateful I am to be an American, and that the system as it was constructed by our forefathers is a system that works. And, the media doesn't always portray it to be exactly as it is. Hill staffers are incredibly bright, incredibly hardworking. They work tirelessly on behalf of the American public. I'm so grateful that there are people who are willing to do the work. And they're some of the brightest people I've ever met. They could have any job they wanted, and yet they choose to serve the nation, which is really something I'm incredibly grateful for.
Yeah, it is interesting to be there, to be here, be in this area, and actually working with people, doing the work, and then you watch the television, and you're like, that is so not the reality of what's going on. Like, so that, that's a whole nother.
Well, I also am so grateful we have a free press and we have a strong, nation of press and media that does their job and tries to work hard to get it right. I found in my time, for the most part, the media's portrayal of the information was right. It was potentially exaggerated, but the truth is, I thought the media, for the most part, got it right. And I'm grateful that we have a free press and that there are people who want to do that work as well. Being a journalist is really a difficult job, so I'm grateful that we have people to plug in all these holes and make sure the public knows what's going on.
Yeah, so I call them the fourth P: your policy, politics, process, and the press. So they all play a vital role for communicating information. So let's then transition to, because the U.S. Surgeon General actually spoke at GW, and I got a great picture of Dr. Adams taking a selfie with some of our students. So he's a really personable guy, but also saw that you got to meet Dr. Satcher. So talk about kind of why you went to the Surgeon General's office and some of the things that you got to do there.
So the reason, I ended up in the Health Policy Fellowship, I had watched it a long time. I had been well aware of it. I sort of wanted to approach it at the best point in my career where I thought I could both contribute the most and take advantage of it the most. And one of the reasons I pursued it is that I've always considered my research to be policy relevant. The research questions I ask always have a policy angle, how a policy affects healthcare, how healthcare affects policy, sort of that interaction. But I wasn't ever really certain if policymakers use the deliverables of research in the decisions they're making. So that's really what led me to the Health Policy Fellowship, to sort of understand how policy research is consumed by policymakers. So I think I definitely got a flavor of that in the speaker's office. That said, as you know, there are so many different parts of government. And I thought it was important for me to really understand the full breadth of policy decision making. And so transitioning to a different office in the administration, obviously, a different branch of government, different leadership, different administration. I thought seeing how a different office utilizes and consumes research would be really very interesting for me. The Office of the Surgeon General was the perfect place to do that because it's all about research. The Surgeon General's office is all about taking the latest evidence about disease and health, translating that and communicating that to the American public. So it was really the perfect place to see how an office within government, within the administration, takes evidence that's produced by researchers, people like you and me, and consumes it and translates it for the American public. It was a very different experience. Also, when I'm incredibly grateful I had both experiences. As you mentioned, the Surgeon General is incredibly charismatic. He's a people person. The office is very small, whereas the Speaker's office was maybe 40 or 50 people. The Office of the Surgeon General was 12 or 18 people. It's definitely a roll up your sleeves kind of office where everybody gets involved in almost everything the Surgeon General does. He is a very hands-on kind of leader. It would not have been unusual for him to pop into a meeting that I was holding on his behalf. It would be very like him to sort of, walk, through the office, seeing what's going on. He was very accessible, both to the American public and to the staff who works for him. There, the work was a little bit different. There, it's about translating evidence for purposes of consumption by the American public. So it was a lot of speech writing for him. It was a lot of producing reports that would come out from his office to the American public about different issues. While I was in his office, I wrote actually a report on adverse childhood events, ACEs, and it was a report that office was required to write for Congress, and so it was a congressional report from the Office of the Surgeon General to the various committees in Congress, and so I had a role in crafting and producing that report. I also worked in the marijuana space. The Surgeon General has a deep interest in sharing with the American public the hazards and harms of cannabis and marijuana, so I worked a little bit on that issue for him. And maternal mortality is also part of his platform. So a variety of issues that are important to him really were sort of what that office was all about.
Yeah, I think the opioid crisis.
Opioids, yeah.
Yeah, very personal for him. And so that kind of, so talk a little bit about meeting Dr. Satcher, because a lot of stuff I was just thinking to myself, both of those people, leaders have had something to do with the opioid crisis.
Right, yes. So meeting Dr. Satcher was actually part of the orientation phase of the fellowship.
Okay.
As you know, you've got that part of the fellowship includes dozens and dozens of briefings by various policymakers and Washington insiders. As part of that orientation, the RWJ Health Policy Fellowship takes a trip to Atlanta, where we spend time in Atlanta at the CDC, and that was actually the point at which I met Dr. Satcher when we were in Atlanta. Definitely somebody who has inspired a nation around healthcare and medicine, and an important figurehead for definitely the Office of the Administration, the Office of the Surgeon General. That was a lot of fun.
So what's next for you?
So I've been back at GW since January, and it's been wonderful to return. As I mentioned, I hope the part of the fellowship was really trying to see how policy is consumed by policymakers and people in Congress and the administration. So I've returned to my program of research with a much deeper understanding of how to ask research questions, how to pursue research, so that the deliverables are more, I guess, consumable or usable. So not only, I think, has it changed the research questions I ask, but it definitely will change the deliverables I produce. I as being part of a faculty, we're always very eager to make sure our research is featured in the latest journals. And frankly, there certainly are people on Capitol Hill who read journals and dive in to the health services research and clinical research. But for the most part, they need research in much more biteable, consumable forms. Mm-hmm. So policy briefs, one-pagers, blogs like what what you produce, those are much more consumable versions. And so I think as researchers, we have an obligation, if we want policymakers to avail themselves of the work we do, I think we need to produce our research and our findings in different formats. And so I think I'll use those lessons in very important ways in the work that I do going forward. I'll also mention that the time on the Hill and in the administration exposed me to a number of topic areas that I would not have considered myself to be an expert in. And so I might have been a little shy or a little intimidated about pursuing research in that space. And as a result of being on the Hill and being in the administration, I have a much deeper understanding of a number of issues that now are part of my program of research. I mentioned cannabis and marijuana. I was just funded to actually do some work in that space, some research in that space. And I think had I not pursued the fellowship and had I not sort of had to do a master class in cannabis policy and marijuana policy, I might not have had maybe the courage, or I might have been a little more intimidated to pursuing research in that area. So I think that's a great example of what the policy fellowship can do for people in academia and in research.
Yeah, so we're actually working with two co-authors were writing kind of a book on how healthcare professionals can use, social media and to kind of build their professional online presence. And one of the chapters, what you were just talking about, reminded me, was writing this chapter on kind of like traditional gold standard ways to disseminate science versus innovative ways. And as academics, we have to do both. But I know that watching, staffers on the Hill, like they started with Google versus I might start like at the library in the peer-reviewed journals, but still then had to be able to translate that to where people could understand it. So, if you are doing science or you have an area of expertise as a healthcare professional, you have to do the gold standard stuff to establish your expertise, but having, a website with a blog or doing like an infographic, and some of the other things that you mentioned, that's really how people can find your work. The public can find it. So, very important.
Well, if I were, I guess one of the hopes I would have is, based on the experience, it's my own belief that what's rewarded in academia doesn't really align, of course, with what policymakers need. So if I had to wave my magic wand, it would be, for folks in the academy to really reflect on that misalignment and try to realign things. So just as an example, we are incentivized, obviously, to publish in the peer review journal space, which is important. That will never go away. And yet, all of the time, Melissa, you spend to have a presence on social media, time I might spend to produce one-page policy briefs or that infographic that you mentioned, those typically don't count in the academic circle. What counts in the academic circle is the peer-reviewed journal. So I would like to, personally, if I were to wave my magic wand, it would be to create an academy that sees that in a little more balanced way and incentivizes you to have this broad social media presence as you've had, at the same time that you're trying to obviously produce your work and make sure it gets mentions in the more traditional academic journal space. So perhaps that's a vision for the future that we
right. I think it's coming. So and I think a lot of it just has to do with how do we demonstrate and speak to the impact of our work. And I know several times in my career, I've done projects that people have told me not to do, but I felt like they were important, and they've turned out to be the projects that have had the biggest impact. And so that always goes into kind of the intellectual statement and how you talk about things. So it is a skill set, and I think that your vision will be realized if I have anything to do with it.
Yeah, it would be. I appreciate the tradition, and that will never go away. That will always take center stage.
It's an important aspect. It has to happen. So,
well, I think there's no, there's nothing more important than having research inform real life, right? And have it inform decisions that are made, in the nation that affect the country. And there's no question that a peer-reviewed journal can have incredible impact, but something that impacts the way a policymaker is thinking or viewing an issue that they're grappling with and how they, pursue that either in lawmaking or in policymaking. That would be the greatest compliment of all. Alongside maybe a JAMA paper. So to have more balance, that would be, I think, an ideal place to aspire to.
All right. Well, I think that's kind of all the questions I have for you. Are you any final thoughts or comments that you'd like to add?
Yeah, no, as I mentioned, I think the greatest lesson for me in the policy fellowship is just how grateful we should all be to be Americans and have really hard working, incredibly bright, talented men and women doing the work of lawmaking and policymaking in Washington, D.C. It's hard work, and it's underappreciated, and I have great appreciation for it now, as I'm sure you do.
Right. They're very much, I think the biggest difference I think that I saw was the time pressure. Like as an academic, you have time to sit and to think and to decide how you want to lay this paper out. And, if you're in DC, they're like, we need this paragraph in the next 30 minutes. And you're like, So,
well, yeah, and I think the writing that we do in academia does not lend itself to the writing that needs to be done on the Hill, right? We're used to writing 25-page papers or 3,500 word journal manuscripts, and in there, if you get a page, you're lucky, and so you have to. It's a different kind of writing. You have to train yourself differently. Now I'm having to retrain for academic writing. It's definitely a different skill and talent.
all right. Well, thank you so much for being.
Sure, it was a pleasure. Thank you. Appreciate it.
All right. Thanks so much. Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.